presentation covers some of the key policies and procedures on clinical placement that you'll need to be aware of as a clinical or educational supervisor for Chester Medical students. Topics covered in this talk will include how to manage general queries on placement, what the student agreement is, some links for key policy documents, what are professionalism concerns and ways of reporting these, what the University Professional Concerns Procedure is, and some further information about wellbeing and student support you can signpost students to. So for medical students on clinical placement, for general queries, a first port of call will be the educational supervisor, the undergraduate local educator placement teams, but also within the University of Chester you can contact medicine@chester.ac.uk for general queries. You can contact me, the Year 2 clinical lead, at n.connolly@chester.ac.uk. All students have a personal academic tutor who stays with them throughout the MBCHB course, who is generally a named member of faculty staff based at the university. Students are encouraged to list their PAT tutor on their undergraduate medicine portfolio, and it is encouraged that the educational supervisor and PAT can liaise together if any concerns arise about the placement. We are also setting up a Chester Medical School clinical placement newsletter, which will be sent to both students and educators on a weekly basis to keep you updated about current timetabling events, meetings for educators, and to provide feedback and guidance during the placement in real time. With regard to queries and concerns, our main advice is to please report any concerns you have about how the student is getting on sooner rather than later. Every year, the students at Chester Medical School will sign an annual student agreement. This sets out the GMC standards that are expected of the student on placement for the students to be aware of, including professional behaviours. Some key policies to be aware of whilst supervising students are that students are encouraged to raise their own concerns where appropriate with a specific document to guide this, what the dress code is for medical students from Chester. There is a policy surrounding the student use of guide to using social media. One of the main policies is the raising concerns and professionalism and fitness to practice, and there is a lead within the university. There is also a safeguarding policy from the university, and we would encourage you to follow your own local safeguarding policies where appropriate. There is also an attendance policy, and it is reminded that students are expected to attend 100% of all timetabled activities and should report their own absence if this fails to occur. Here are some key links to those policy documents. So, monitoring professionalism concerns. The GMC states that it's really important we have a formal process for monitoring and reporting low-level professionalism concerns. These include things such as lateness, not handing in work on time, and missing learning opportunities. This allows the medical school to identify any unprofessional behaviour early on and address it before it could lead to any more significant fitness to practice issues. Other low-level concerns are outlined here. As you can see, they would include being rude to patients, colleagues, and unwillingness to learn from constructive feedback. There are a number of ways of reporting concerns that you may have about a student or group of students that you encounter. The first way would be to report it to the educational supervisor, a subclinical dean if there is one in post at that trust, the undergraduate medicine team, the Director of Medical Education for the Trust, and following local safeguarding processes. In terms of raising concerns to the university, you can use the medicine@chester.ac.uk email address, and the phone number listed there is manned Monday to Friday 9 to 5. There is also an external web page that you can access if you type into a search engine University of Chester report a concern. This slide outlines the process that students can follow if they raise concerns whilst on placement, which we encourage the use of where appropriate. This is the formal process for managing concerns that are raised to the university. As you can see, all concerns can be reported through a number of different channels and will then be investigated by the professionalism lead in the faculty. There will be a health, welfare and conduct panel every 14 days, which is carries a supportive role. It will investigate and gather information about the concern, and most concerns will be dealt with at this level. If concerns are serious or support fails, the student can then be referred to a fitness to practice panel, which would include a GMC registrant, proctors and other faculty staff. This will involve a formal interview with the student and can carry a number of possible outcomes, including written warnings, suspension and expulsion. Here is a picture of the Report a Concern external webpage and a link at the bottom of the screen. As mentioned, any low-level concerns can be reported using this function or using the medicine@chester.ac.uk email or phone number. Please also consider reporting excellence, and you can ask for a commendation form regarding any excellent behaviour, clinical skills you see from students by emailing the medicine team. The types of commendations could include showing significant support for others, kindness towards patients, students and staff, humility, integrity, any significant innovative or creative work, voluntary work, or high-level ethical behaviours such as raising concerns and reporting concerns from the students. This can also feed into the end-of-year professionalism assessment, where students may be identified for merit. This slide outlines the wellbeing and student support services we have available at University of Chester. As you can see, there's support to help with emotional, financial concerns. There is a chaplaincy service and a 24/7, 365-day-a-year student assistantship programme to help students with a range of concerns.